But tonight, our big focus is on the second wave of Corona-19 or COVID-19 that has spread across India now like wildfire. Active COVID cases at the moment, 7,41,830. In the last 24 hours alone, we've crossed 1 lakh cases. Deaths in the last 24 hours are 478 at the moment. Now remember, the biggest wave is taking place in Maharashtra. Active cases, 4,30,000 cases in last 24 hours. 57,074 deaths in last 24 hours, 222. But clearly the crisis now has in a sense put the government on the back foot, both at the centre and in several states. As for the first time, the country has reported over 1 lakh cases in a single day. While Maharashtra remains the worst hit state, accounting for nearly 58% of India's total active case tally, the challenge now is how do you contain the spread and break the chain? The Maharashtra government has imposed new restrictions starting from this evening, but will the nation also have to follow a potential mini lockdown? It's our top story tonight before we are joined by Dr Randeep Guleria.
India has hit a grim milestone. It reported over 1 lakh new coronavirus cases in the last 24 hours, the highest since the outbreak. With this daily surge, we have become the second country after the United States to clock over 1 lakh cases in a day. Maharashtra continues to be the worst hit state with more than 57% of the active caseload of the country. With COVID situation spiraling out of hand, the state now is under a mini lockdown of sorts. The government has shut down playgrounds, parks and beaches. Sitting in restaurants and bars will not be allowed. Theatres too will remain closed. A full lockdown will be in place across the state on the weekends. This is in addition to the night curfew from 8 p.m. to 7 a.m.
लॉकडाउन लगेगा तो कम से कम लोग अपने घर में रहेंगे, सेफ रहेंगे, उनके लोग कोरोना कम से कम कंट्रोल में आ जाएगा.
कोई कितना भी कुछ कर ले, जब तक पब्लिक अपना सेफ्टी नहीं देगी तब तक कुछ नहीं हो सकता.
Amid the unprecedented surge, the Uddhav Thackeray government has assured people there are enough hospital beds to tackle the surge.
जो पहिला त्रास जाणवायचा सुरुवातीच्या काळामध्ये तेवढा त्रास जाणवत नाही. आताही व्हेंटिलेटर आपल्याकडे उपलब्ध आहे. फक्त ऑक्सिजनच्या बद्दल मात्र ऑक्सिजनचे बेड हे मोठ्या प्रमाणावर आपण खासगी हॉस्पिटलची पण मदत घेतोय. सरकारचे जे हॉस्पिटल्स आहेत त्याची पण आपण सूचना दिलेली आहे आणि तिथं कुठल्याही परिस्थितीमध्ये ऑक्सिजन बेड कमी पडू नये.
With several states reporting a sudden surge in its COVID caseload, Prime Minister Narendra Modi has called for a meeting with Chief Ministers on April 8 to decide the future course of action. Bureau Report, India Today.
And joining me now is Dr Randeep Guleria, Director, All India Institute of Medical Sciences, also part of the COVID task force. Appreciate your joining us as always, Dr Guleria. It's a pleasure having you. We are going to take a lot of viewer questions that have come in. The big question, sir, at the very outset, what explains the surge specifically in one state like Maharashtra? 58% of the cases coming from one state. Is there a strain which is different in Maharashtra, which is more infectious?
I don't think so. What I think is, as we know how the pandemic behaves and how, as we've seen it in the past, it starts in one region and then spreads to the other. It happened in Italy, it happened in Spain, it happened in the US, where it started off in New York and then spread to the other parts of the United States. So pandemics move from one area to the other. Currently, Maharashtra is seeing a huge number of cases because that's where if it's a new variant strain or the infection has spread more rapidly, but it is now gradually moving to other states, and that is a cause of concern because for the first time, we have crossed the 1 lakh mark per day, and we have done this in a very steep manner, and this is a grave cause of concern.
So you're saying that in the days ahead, it may not be limited to Maharashtra, the numbers could rise exponentially in other parts. Am I correct, doctor?
Yes, unless we are very aggressive in the actions that we take, this could sort of spill over to other states, and that could cause increase in the overall numbers in the country.
I'm going to come to that action in a moment, Dr. Guleria, because my next question is quite simply what Maharashtra has done, doctor. Do night curfews and weekend lockdowns work? Maharashtra has gone in for night curfews and now for a weekend lockdown. Is that a solution in your view to break the chain?
So that's not a total solution, because if you have a night curfew, but during the day you allow people to mix, you have crowds and you have people not wearing masks, then you're still allowing the infection to spread. So even if you limit it, that there is a curfew in the night, but there is no restriction in the day, it's not going to be really effective. And that is why we need to have more aggressive action in terms of making sure people follow COVID appropriate behavior, making sure that the crowds are not formed so that they don't become super spreading events, and therefore activities which can lead to crowd formation are totally not allowed. And we start doing a very aggressive surveillance to pick up those areas which are hotspots and sort of convert them into containment zones and have some sort of a lockdown strategy in that area so that the infection doesn't spread from that area to other areas.
You know, Doctor, you made two important points already. One, you're saying this surge may not necessarily be limited to Maharashtra. It could spread to other states. And you're saying also that a night curfew and a lockdown only for a few hours or a weekend doesn't work. Therefore, our next question is, how real, Doctor, are fears of another national lockdown? The Prime Minister has called a meeting now of Chief Ministers on the 8th. You're part of the COVID task force. Is it possible that what's happening in Maharashtra could be replicated in other parts? Could we be heading for another national lockdown?
I don't think we'll have a national lockdown, but there could be regional areas which would take such measures in terms of having containment zones, looking at lockdown in that area, and also very aggressive testing, tracking, treating, and isolation needs to be done, because we have to really decrease the number of cases, or at least not allow the cases to rise with the rapidity which they are rising right now. And the reason for that is that if we allow this to happen, it will lead to more strain on the healthcare facilities. The more the number of cases you have, proportionally larger the number of people who would need hospital care, and more will your healthcare facility get strained in a shorter span of time. And if the healthcare facility is already overburdened, this may create a problem as far as management is concerned. Therefore, the only option that we have is to work aggressively to decrease the number of cases so that the number that really needs hospital care doesn't rise up and exceeds our what we have currently available.
Okay, so you're saying no total lockdown. If there is a lockdown, it will be much more localized. It should be directed at areas where surges are detected. You also mentioned, Doctor, earlier that we need to avoid crowded places or overcrowding in places, which brings me to another question. Can the Kumbh Mela, IPL, lead to a rise in cases? The IPL begins on the weekend, ironically, in Mumbai. The players are in a bio bubble. There are no crowds. But the Kumbh Mela is on in Haridwar at the moment. And linked to that is elections. So, two questions, Doctor. Is a surge likely in election states? And can the Kumbh Mela IPL lead to a rise in cases?
So any event where there is a large crowd and there is no COVID appropriate behavior can become a super spreading event. And therefore, one should try and avoid as much as possible such events, or be very strict in the type of restriction that you put in there to prevent people coming there who are COVID positive and are likely to spread the infection.
Sorry, Doctor, why hasn't the COVID task force sort of read out, dare I say, a red card to our politicians saying, look, you're holding these big rallies where people are coming without masking, without social distancing. Maybe we need to find some way to control that.
Yes, and I think it's also an individual's responsibility. After all, people who are coming to these rallies also should understand their own responsibility, wear masks and make sure that they don't form a crowd. It's something that has to be done both. So if people started doing this and not coming to large rallies or not coming to where there's a big crowd, automatically we would be able to bring it down. But if you are not having that and you don't understand your responsibility, then it's going to be a difficult situation. So it's something that has to be done from both each individual and also from as a group in terms of decreasing the crowds and making sure that there is COVID appropriate behavior.
You know, why? Because, Doctor, a lot of people in Mumbai, I know, are saying that, look, you're telling us to stay at home, not even go to offices, work from home, put all these restrictions on us. But the Kumbh Mela is going on at Haridwar. The IPL is going to begin. Do you feel that maybe we need to relook at some of these events at the moment?
We need to have a look at these events and see that we are able to, if they have to go on, we are able to have strict restrictions available so that these don't become super spreading events.
Okay. The next question, of course, sir, comes to the issue of vaccinations. The vaccination drive is picking up. Now people over 45 allowed to vaccinate. I had my vaccination over the weekend. The question is, can a vaccination bring down infections? People are worried that despite vaccinations, there are cases of reinfections coming. So how confident are you that vaccinations, a more enlarged vaccination drive will bring down infections?
So when we're looking at vaccination, we're looking at two broad things that we want to do. One is to decrease our mortality. And we know that vaccination will prevent severe disease and death as far as the high-risk group is concerned. And that is why we're focusing on vaccinating the high-risk group. The second is to prevent infection and therefore break the chain of transmission or decrease the transmission rates. That data was not that strong, but there is now recent data which is emerging even from the AstraZeneca vaccine, Covishield, which suggests that that vaccine also does help in decreasing the rate of transmission. Therefore, if we are able to vaccinate a larger and larger number of individuals, we will be able to decrease the number of cases, but that strategy alone will not work. This has to be a multi-pronged attack. Vaccination is just one part of the strategy. COVID-appropriate behavior is another part. Increasing testing in these areas and then isolating individuals, quarantining, and tracking all the contacts is another strategy. And then working on decreasing the crowds is another strategy that we need to follow. Unless we do all of this in parallel, we will not be able to really bring down the cases. So just saying that we will vaccinate and we don't need to have COVID-appropriate behavior is not correct, because this is the sense that people have, that now that vaccination is being done, they don't need to wear the mask, they can go out and party, they can go for a holiday. That attitude has created the spike that we're seeing right now.
Linked to that, Doctor, a number of people are asking, what is the ideal duration between vaccinations? Some confusion over Covishield. First it was said 28 days. Now it's being suggested that it should be 6 to 10 weeks. What do you recommend? And do you believe that there is a choice that Covaxin is better than Covishield? How do you look at those who would like to choose their vaccine?
So both vaccines are effective. The data is robust for both vaccines. There is really not much difference. But the Lancet study, which was done, which looked at, based on the fact that UK initially started delaying the second dose of vaccine so that they had enough doses to give right across, the data that they collected, and some of it is based on statistical analysis, did tend to show that if you were to delay the second dose beyond 6 weeks, your immunity or your antibody response was slightly better. And based on that, the duration has been from 4 to 8 weeks. And you could get it done any time between that. If you got it done after 6 weeks, probably it will give you, based on that paper, it's not a very large study, a little bit more.
So what would you recommend? What would you recommend, doctor, to someone like me who had his vaccination 2 days ago? Should I take my next dose after 6 weeks?
So if you've taken Covishield, yes, you should take it between the 6th and the 7th week.
Between the 6th and the 7th week. Okay, the next question, doctor, is an interesting one. Is the middle class getting most affected in the current surge? Doctor, we are seeing a number of high-rise buildings in Mumbai particularly affected. Other parts also. We are seeing much more middle-class colonies being affected and not the slum colonies. What explains that?
That does seem to be the case as of now, because whatever we've been able to see also, it seems the same thing, that it's more in colonies and middle-class people. I think when we had the first wave, the bulk of people who got affected was in the lower socioeconomic status. We had it in the urban slums, if I may use that word. And that led to a good amount of immunity in that population. But because of the precautions that were taken at that point in time by people, middle-class people, in terms of COVID-appropriate behavior, staying at home, that they did not get the infection, but they were still susceptible. That's what the serosurveillance data showed. Now, because they've been sort of having COVID fatigue, they have sort of now started decreasing COVID-appropriate behavior, let their guard down, gone out, and they are still, because they are susceptible, are more likely to get the infection.
Along with that is something that I read that you said in the newspapers last week that created a stir. And the question, therefore, doctor, is this. Are youngsters getting more infected now? Are they more prone to COVID-19 at the moment? Those below the age of 35 seem to be more affected at the moment?
So it's not related to the virus causing more infection in the young age group. It's related to the younger age group going out more frequently, and the fact that the younger age group feels that this is a mild illness in their age, and therefore they need not worry. There's a lack of fear. And that's why if you look at markets, or you look at restaurants, or you look at pubs, or if you look at other functions, a lot of young generation is moving into these areas without wearing masks,
Right.
even going on for holidays. So they are the ones who are getting more exposed and therefore are getting the infection. So it's more related to lack of COVID appropriate behavior rather than the virus attacking the young people. The worry that I have is basically two. One is
Yes.
they will take this infection, even if they have a mild illness, they will take this infection to their houses and they will have their parents or grandparents staying with them or getting exposed to them, and they may get the infection, which could be very serious in them.
I think you're making a very important point that it's the youngsters who are getting infected because they're the ones going out and not following COVID appropriate behavior, but they could bring that infection back to the elderly parents who are staying at home. May I ask this also, doctor? The next question is, what symptoms should people look out for after vaccinations? You know, I took mine on Saturday. I had no pain, nothing, but I had a bit of fatigue yesterday, took a dolo. What symptoms should people be looking out after vaccinations? Is there any troubling symptom we should look out for?
So most people after vaccination usually have no symptoms. Some of them may have a light or mild ache at the site of the injection. Some may have fever for a day or two, fatigue, body aches, and headache has been another complaint that some people have had. Some have complained of gastritis, and I know a few people who've had even diarrhea. But all of that is settled within a day or two. So these are mild symptoms which may occur as a part of the body's immune system reacting and trying to form antibodies. So there's nothing to worry about.
The other worry, doctors, that people have, will more vaccine options be available soon? Sputnik has been pushing for its vaccine to be made available. Pfizer was also at one stage ready to come to India. There's a fear that maybe you all have created a duopoly of just Covaxin, Covishield, and the numbers, therefore, who are coming in are fewer. I was told Apollo Hospital in Delhi is just doing 250 vaccinations a day. That's clearly not enough. Are you going to increase the pool and possibly also push for vaccinations to be made available in cooperative societies, in corporate buildings, so that many more can get vaccinated, doctor?
Yes, I think that is what we need to do, and I'm sure that the government is also planning that. What we need to look at are two things. One is the manufacturing capacity of what we have and what can come in, and the regulatory approval. So for Sputnik or Cadila or for Pfizer, they have to have the regulatory approval because we have to be sure that the vaccines are effective and safe in the Indian population. If that has been shown to the regulators, they would get emergency use authorization, and it would add to the pool of vaccines that we have. But the current pool of vaccines that we have still is less to meet the demand that is there. And therefore, that is why there is a graded response in terms of the vaccine rollout. But the vaccine is still available for the people over the age of 45. And in many centers, the number of people being vaccinated has gone up dramatically. We are now vaccinating more than 1,000 people every day since the 1st of April, because the demand has gone up. And there is no shortage of vaccine from that point of view, but a strategy needs to be developed by each center so that they can get those vaccines and they have enough people to vaccinate.
But you see a potential where RWAs, cooperative societies, big companies can vaccinate on site rather than only in hospitals.
Yes, that can be done. It can be done on site. It can be done in offices. Only thing is, it has to have 2 or 3 things. The cold chain has to be maintained, and there has to be a team there which can monitor for side effects and treat those anyone who has any side effects, especially during the half an hour that they are observed there.
Right.
So if that can be made, then it can be done in corporate societies. It can be done in offices. And that will really help us to increase the vaccination sites.
So you see that happening over the next week, 10 days, maybe by sometime this month of April?
That should happen soon, yes.
Okay. The other question, doctor, which you said just now about symptoms, someone has just asked, have you seen or heard of any instance of blood clotting after vaccination recorded in India? Is that a fear or is that an exaggeration?
So it's not something that has been seen in India. There have been some reports where individuals' platelets have come down a little bit, but has not caused significant problem. And then the issue has always been there that is this a cause of a vaccine or is it coincidental? And that is why all the adverse effects which we are seeing because of the vaccine are being looked very closely by a group which looks at the adverse effect following immunization. Each adverse effect, especially the serious adverse effects, are looked at. And currently there is really no data which suggests that the vaccines which have been given in India are actually leading to a higher incidence of blood clot which is a concern as far as Europe or other parts of the world are
Right.
there.
Sir, the other question is a really big one which is being asked by a number of people. How soon can those under the age of 45 expect a vaccination?
So that will depend how quickly those over the age of 45 come forward and get themselves vaccinated. Because we would like to decrease mortality and therefore first vaccinate the high risk group as early as possible. And to decrease that, everyone, if everyone over the age of 45 came forward and got themselves vaccinated, let's say in 3 to 4 weeks, then it would come down to the lower age group because vaccines are available. So that is the challenge that we have. It would be a problem if we were to open it up to everyone and then we had a large number of people who were at the older age group who did not get vaccine and therefore had serious disease and died because of COVID-19. Therefore, I would urge everyone who's over the age of 45 to really register and come as early as possible to get himself or herself vaccinated so that we can then move down the priority list to get more and more people vaccinated.
So I take your point, but the flip side is that, if the young are getting infected at the moment, if they are ready to vaccinate, if there is a vaccine wastage in several parts of the country, why not just open it up, sir, faster rather than wait for everyone above 45 to get vaccinated?
Because we should have enough doses. If we were to open it up for everyone, if you look at the adult population of India, it's around 97 crores. So let's say if we have some round it off to 1 billion people, we will need 2 billion doses to vaccinate everyone over the age of 18. We don't have that many doses, even if we were to get all the doses from Pfizer, Moderna, and other companies. Therefore, we are a large country, and therefore we must understand the constraints that we have. And our first aim, as far as vaccination is concerned, is to decrease mortality.
Right.
We have to decrease our death rate. So we have to vaccinate the high risk group first. If we had enough doses, yes, we should vaccinate everyone in one go. That nothing would be better than that. But we must understand our population size and the limited doses that we have. So it's a supply-demand issue, and that is why it has to be done in a balanced manner. I'm hopeful that in the coming months, we may have enough doses that we would be able to open it up to everyone, and that would be a very good thing.
Do you want to set a timeline for that opening up? Do you see that happening by May, June?
It's difficult for me to really give a timeline because it depends on what the manufacturers can deliver and how many other vaccine manufacturers can come in and what doses they can supply. Like I said, we would need, even if we were to look at a lower age group, we will need, let's say, 1 billion doses. We need to work on that. Do we have that many doses to supply to our population?
Okay, sir. The other question that is being asked, is the second wave, doctor, that's happening at the moment more infectious but less deadlier? The mortality rate, case fatality ratio seem to be relatively lower, but the infection is spreading. Would I be right to say it's more infectious but in a sense milder?
Currently, it is definitely more infectious and milder, but that could be related to the fact that, as we've just said, currently it seems to be infecting the younger age group more, and we know that the mortality in the younger age group is less. But as it moves to the people with comorbidities or the older age group, the mortality may rise, and that is a cause of concern because that will lead to more admissions and that may lead to higher death rate. And this is being seen in some parts, I think even in Maharashtra, because now they are finding an surge in the number of patients coming to hospital, which was not there in the early part because it was basically a much milder disease.
Is a change of season, doctor, a reason for the COVID surge? The fact that we are entering these summer months, does the summer make it more difficult in a way to control the surge? Is there any correlation between this wave and the onset of summer?
So that correlation we've not been able to find if you look at data over the last year. And if you look at data from various parts of the world where we've had winter and summer and tropical and say temperate climate, a lot of respiratory viral infections tend to be more during winter months and during change of weather. What we've found in the past as far as influenza is concerned, it is more during the winter months and more during monsoons. And it tends to actually come down when the temperature goes over 40 as far as India is concerned. But that is not happening with COVID-19. It seems to be there throughout the year. So currently it is throughout the year. Maybe over the next few years it will develop a seasonal pattern, but that is something we need to see over the next one.
Because I read the epidemiologist Dr. Girdhar Babu saying these 4 weeks are critical of April. Do you believe April is the critical month? If we can break the chain somewhere by the end of April, things could get better come May.
So if we are able to do two things, one is decrease crowds and get COVID appropriate behavior being followed by everyone and get vaccination ramped up, I think maybe by the end of April or beginning of May, we may be able to get the cases down. But if we don't do that, then the spike may continue for a longer period.
Does exposure to pollen make one vulnerable to COVID is a question being asked, doctor.
Not necessarily exposure to pollen, which makes one if someone has allergic rhinitis or asthma, can worsen his underlying disease, and therefore, if he does get COVID, there is a chance that it may become a little bit more severe. But it doesn't mean that you are you have a higher chance of getting the infection.
One final question, doctor. Protocols to be followed. If I have taken my first round of Covishield or Covaxin, and then I contract COVID, what should I be doing? If I've taken one round of the vaccine and then I get COVID, what should I do?
So it's important to understand that the first shot of the vaccine does not give you immunity to say that you are totally protected. If you get COVID infection, and there are people who have got COVID infection after the first shot of the vaccine, the treatment strategy remains exactly the same as what we were doing even if we had not got the vaccine. And the treatment and the protocol in terms of isolation, in terms of the COVID appropriate behavior, everything remains the same. That doesn't change at all.
My final question, doctor, after 2 rounds of the vaccine, can I 2 weeks later, 2 weeks after the second round of vaccine, be far more safe that I've got sufficient antibodies that I will not be affected by COVID?
So like I had said, after 2 weeks of the second dose, you can be confident that you have the chances are that you will not get severe disease. And even if you get COVID, you will have a milder disease. But you can still get the infection, because what we know is the vaccine protects you from getting severe disease because of the antibodies it produces. But you may still get a mild disease, or you may be asymptomatic, and therefore you can still be infectious.
Doctor, you've been very kind to come today, and I'll tell my viewers why. Today is your birthday, I'm told, doctor. So happy birthday. You didn't tell me in the morning when I asked you to come on the show. I wouldn't have called you on your birthday, but you've been very kind to come on your birthday. I won't ask you how old you are.
Thank you very much.
But happy birthday to you. You've had a very, very difficult year, and you've always come and answered our questions. I think many viewers really appreciate it. And I hope that we can get on top of this second wave by the end of this month at the very latest. Thank you very much, Dr. Guleria, and happy birthday. How are you celebrating your birthday?
I'm just staying at home and having COVID appropriate behavior.
Okay. Thank you very much, Dr. Guleria, for joining me here on India Today. Okay.